Hi, good evening, everybody. This is Dr. Schilling from Sequoia Health, bringing this week's Wednesday Wellness Minutes, and we're going to switch it up a little bit because today we're going to talk about post-traumatic stress or post-traumatic stress disorder. And this is we're doing a courtesy for one of our active participants who has a military family and came across this article which was related to this innovative new therapy that the medical world is using for PTSD. And so just to give you an idea of what PTSD, if you have any appreciation for our military and how many things we've been involved in since 2001, since the 9/11 attacks, approximately 3 million service members, men and women, have gone overseas to serve our country and keep us safe here at home since 2001. And it's been estimated that 14 to 20% of them have come home with post-traumatic stress or post-traumatic stress disorder. Now, I'm sure that number is highly underreported, given the nature of a soldier and things like that. They tend to hide things. Human beings tend to hide them in general, but certainly soldiers, it's a shame thing. They want to feel strong and be confident, and so the ones that are actually reporting it are probably the more sensible, and the individuals who can't report it, they're suffering even greater. So our heart goes out to them for that. But this was done by 60 Minutes expose, if you will, about a former Navy SEAL. He received the Medal of Honor. I think President Obama put it on him for his bravery in theater and things like that. But what's amazing is to understand is this affects people's lives. They're described as they can't get the war out of their head. They bring it home with them. So the gunfire, the sounds, like someone, a car backfires or a loud noise, a door shutting, it all triggers these things. So what we understand is it's in the brain, right? So this poster back here is all about the brain. And this is critical as far as understanding how to get rid of PTSD or post-traumatic stress trauma, because it is in the brain, right? We feel it in the body, but it's in the brain. And we'll talk about that in a minute. So we want to improve these people's lives. This is controlling their lives completely. But 80% of people that received this therapy benefited from it. So let's kind of talk about that. It is a new injection of sorts, not done anywhere else but within the medical world, and it's experimental at this point. So it's called stellate ganglion block, and stellate ganglion is a specific part of the brain. So what they do is they take a needle and they inject it back here at the base of the skull, and really infuse this anesthesia into the body, which basically takes completely disruptive noise and chatter and irritation to the brain and calms it down. So it gives people a chance to really take a step back. The best analogy the Marine used to describe it was that it's like going from being downtown Manhattan, maybe in Times Square, and it's loud and obnoxious and there's constant noise, and then finding yourself in the country, driving down the road, not having any stress, not nowhere really to go, and having to be able to have that clarity and that, like, holy cow, the veil has been lifted, 100 million pounds has been lifted off your body and stuff like that. So what they do is they take an ultrasound wand and they look at the tissues, and then this physician specifically injects it into a certain area of the brainstem and near the cord, and then it affects the stellate ganglion, and so it's an anesthesia. So it's going to wear off, but at least it gives these people, these soldiers that are struggling as they return home, it gives them a break. So it can last for months, but it's going to wear off, so we need to get to the root cause. And that's where things like Q&RT come in. I think Grey's Anatomy had something about NET, which is called neuroemotional technique. The way I describe the difference between Q&RT and NET, neuroemotional technique, is Q&RT is like NET on steroids, using the cranial nerves and getting down deeper into the brain, finding the stress traumas. And then, of course, as you know, we're using neurofeedback to expose those long-term and short-term traumas, just like soldiers are going to have for being in theater, and that's going to help push them to the surface so we can then repattern the brain and help the brain adapt better. So this is no longer this chatter. This guy, the Marine, was talking about when he was in and out of this valley, retrieving some of his colleagues or his fellow soldiers. It was like, he said, it sounded like static noise. There were so many bullets hitting his vehicle that it just sounded like static, which you can imagine like a TV going to no station and to constant. You can imagine getting that out of your head. That would be really tough. So that's kind of what they're describing as this new fantastic treatment. But what we want to understand is when we look at the brain, the specific area of the brain we want to look at is the cerebellum and the temporal lobe. Okay, these are both related to memory. So this is cerebellum here is short-term memory. or memory aspects of learning and things like that. The temporal lobe is where you get into the long-term things, and this is speech perception, emotional responses, and language skills. Okay, so this is the really important part here as far as calming down the stress in a person's brain that has post-traumatic stress. And so we want to understand, like, what from a well, we call it German New Medicine, but from a neurological standpoint, let's talk about what PTSD is. Basically, when someone is dealing with PTSD, they basically have what are called relapse conflicts, where they're triggered, as we talk about in QNRT, they're triggered into experiencing something over again. That could be someone says something, they hear something, see something, smell something. You can imagine, you're 30 years old and all of a sudden you smell something, it's like, oh, I remember when my mom was making cookies. Well, that same thing can work for a loud noise or some other thing, can bring a person right back to theater where they're under fire and they duck and cover, and all of a sudden their heart's racing, they're sweating, their hands are cold, and they're going into shock trauma. So it's really intense for these individuals. If you've never experienced it, I fortunately have not, but I know many people have. And this can happen not just from being at war. People can be people that suffer rape, people that suffer sexual assault, physical battery, different emotional abuses and things like that. That can all happen. It can all result in PTSD. So we want to appreciate is that this is real for everyone, not just having been under fire and things like that. So the PTSD, the conflict relapse, is related to your mind slipping back into that. So when it's ingrained into your memory from these two areas, because every aspect of information goes up your spinal cord and passes through the brainstem and the cerebellum. The cerebellum is like the filter on your brain. And this area, this orange part here, it's called the cerebellar tonsil. So if you touch the back of your head behind your ear, it's called your mastoid. Right behind that is your cerebellar tonsil. Okay? So this area here, all the information goes through, and it's a processing center. It makes sure it goes to the right area of the brain. But when it gets over to the temporal lobe, which is here, this blue part, if you can see it horizontally, that's related to that long-term memory. And that's where these traumas, these stresses get trapped in someone's nervous system. And what happens is they can get triggered in an instant, and they have no control over it. Just like someone, someone hits your knee and your foot goes forward, it's the same thing. It's a reflex. You're not thinking it through. This is not your frontal lobe, which is the front of your head, your thinking brain, which is your emotional processing reasoning center. This goes right back to your reptilian brain, which says, I either need to run for my life or I need to fight for my life, one of those. So that's kind of giving you an idea of what happens there. But people go into what's called hypersympathetic atonia, and sympathetic nervous system is the fight or flight. So when these triggers happen, they go into this overdriven state of being hypersympathetic, hyper fight or flight. All the blood rushes away from your digestion. So people with sluggish digestive systems, it's because all their blood is moving away from their insides where they're trying to digest food and rest out to the extremities, because their brain thinks that they're under constant stress or fight, and they got to get out of there. Okay? So that's kind of understanding. So if you have digestive issues, chronic, you always want to take a step back and say, okay, what are my stresses? Who are they? What are they? Where is it coming from? And how do I get rid of it? This will affect what's called vagotonia. Now, the vagus nerve is responsible for your gag reflex, responsible for information from the brain to the gut, and everything in between. Vagus means vagabond, which means it's a wanderer. It wanders throughout your body. So an immense amount of information goes back to your brain and down to your body from the vagus nerve. So when you get kicked into this vagotonia, it's going to cause the nausea, the excessive sweating, the excessive heart rate, and things like that. And people will not be able to sleep. So normotonia. So think about when your body's ready to take action. It's basically between 4 a.m. and 8 p.m., which is why typically when the sun goes down, we should go down with it and go lay down and sleep. Our brains don't operate optimally at that time, although there are certain people that get really creative after sun goes down, and that their nighttime hours are like their most creative. They're just wired differently, but the average person, if you will, is from 4 a.m. to 8 p.m. is the best time frame for understanding your normal sleep rhythm, your normal activity rhythm. You should be sleeping somewhere between 8 and 4. It's well known that for every minute before midnight that you sleep, it's worth 3 minutes after. So if you can go to bed between 9 and 10, you're going to be much better off than going to bed between midnight and 2. Okay, not to mention your gallbladder and liver working really hard in there. So if your gallbladder is trying to detox from 11 to 1 or from midnight to 2, depending on if you're in daylight savings time or not, it's going to cause a lot of problems with that, especially people that are eating late at night because their blood sugar's dropping, they need to stay alert and things like that. So they put stuff in their body, and then their body's trying to detox at the same time you're trying to put stuff in it, It's just a recipe for disaster. And so a lot of times people wake up sweating and hot. It's because there's a lot of adrenaline stored in your liver, and so when your liver is trying to detox something that it's having trouble with, it kicks on like an engine starting, and that's why you get that sweat and stuff like that. But this is just going to give you an idea. So we want to understand that if you have post-traumatic stress, if you have been assaulted, if you've been in war, if you've been in any challenging situation in the past where you're left with that, something happens and you're doing one of these or doing one of these, it just depends on what your reaction is. What you want to understand is it is in your brain, and we need to address the brain first and foremost. So whether you simply need a couple of resets, to get the system balanced and get to the anxiety down or the fear down or whatever it might be, or if it's a deeper trauma from earlier in life, let's say somebody who had a normal life, if you will, and then they went to in the military and they got deployed to war, and then they have a short-term trauma that was 2, 3, 4, 5, 6, 7, 8 years ago, versus someone who had a challenging life growing up and they have post-traumatic stress from being a child, from people who've had their parents say that, why couldn't you have died instead of your sibling? And I mean, you can imagine having a child hear that and imagine what it would do to you as far as messing up your head and trying to make sense of it. Because birth to 7, you're just being imprinted. It's all information just being thrown at you. So anything that happens, discourse in the family, people gone, people sick, alcohol, drug abuse, things like that, children take on responsibility for it. It's common that anywhere between, even up to 13, children take a responsibility for a parent's divorce. When your parents divorce, children take on responsibility for that. But ultimately what we're talking about now is people having post-traumatic stress related to war or some other type of assault. But it works the same for everything. The memory is here. We need to address the memory first. So it's fantastic that they have the stellate ganglion block and that people are getting that relief. At least they can clear the clouds, get the fog out of there, and actually get something like QRT or NET or some type of EMDR, whatever it has to take to get it down. That's fantastic. So we applaud the physician for developing this specifically for PTSD. We're excited that it's giving people the break, but we also want to acknowledge that it's not going to last. And so we need to fix the brain at the root cause, which is between your ears. And fortunately, it doesn't have to require your skull getting cut off and tinkering with your brain. We can do it using neurological and functional neurology repatterning, okay? So if you know someone who's suffering with PTSD, who, a lot of times people don't talk about it, and then next thing you know, someone has committed suicide and no one ever had a chance to intervene or something like that, or that they're afraid to say something because they don't want to put them off or offend them or something like that. Like, it's always better to say something and risk offending someone than not saying it at all. In fact, you can say it like that. I'd rather risk offending you and say this than not say it at all because I'm concerned about you and I care about you. That's a good way to say something. Just let them know, look, I'm probably going to say something that's going to offend you. I'm just going to say it right up front so you know it's coming, and then at least they can be disarmed to a certain extent instead of hearing it and being offended right then. So just use that as a tool. But share this with your friends and family, your loved ones who are suffering from PTSD or things like that. There is hope. They don't have to live the rest of their life, duck and cover, hot sweats, panic attacks, racing heart. Eventually, your body's just going to break down under the constant forces of the hormones in the body related to stress. So please share this with them. Do them a favor so they know there are tools out there for them, whether they get the stellate ganglion block or whether they come in for QNRT or something like that. Let them know there are helpful options out there and that we're here to help. And feel free to give us a call, send a message, send a text, whatever you need to do. We're happy to help. But our mission is to help end needless suffering. People are needlessly suffering out there all day long. And our job, our mission, our purpose in this clinic is to help people eliminate that needless suffering. So let us know how we can help. Please share this with your friends and family. Do them a favor. Let them know there's help out there, okay? And next week we'll be talking more about amniotic fluids and things like that. So tune in next week and we'll be sharing more information about that and some exciting information about people with autoimmune disease and things like that that are unrelenting and unrecoverable, or at least thought so by the medical world. We're going to be talking about a clinic we're partnering with in Colombia in order to do intravenous stem cells that's going to help people with systemic issues that are not legal per se by the FDA standards in the U.S., but we're going to be working with that clinic to get people that support because at certain points things are beyond prevention. So we want to have the tools and provide that service for you. Okay? We'll look forward to seeing you next week for the Wednesday Wellness Minutes. Take good care, everyone.